reason we wanted to have this session tonight is because most of you all know us in the community, your area, your regional community educator, and you are a lot of times out there helping us present our presentations and getting the word out about donation. But we wanted to share with you what our plan is to encourage people to register to become organ, tissue, and eye donors, and kind of let you in on the know. And so tonight's session will be kind of an overview of all the different projects that we have working on in our department. So we've set aside each initiative to be worked on by a different educator, and we've all been working diligently in each area. So tonight we're going to kick off our agenda with Miss Jill Willey, who is our Director of Strategic Marketing, to go over our current marketing activities.
Lana really talked about kind of what we wanted to show you guys today. It really is just kind of a behind the scenes day in the life of what we do. And so we can go to the first slide. I'll talk a little bit about I've come in probably almost 3 years now and heading up the marketing initiatives and community outreach with Kirsten. So we wanted to make sure our branding pieces were together. Our collateral was all the same. Our digital media was in sync with everything. So we worked really hard the past couple of years to make sure, so now hopefully, when you see that heart icon, it is LOPA, we're really making strides with that in our branding. Our collateral pieces are our brochures, things that you see out and about, rack cards, and then digital would be our website and our social media marketing that we are in charge of. You can go to the next slide, shows some examples of the pieces we've done that are out right now for you guys even to use. What you see is We Work in Miracles is what's called our general brochure. That is a trifold, and it does talk about what LOPA does and our mission, our core purpose of making life happen, and what does that really mean and what does that look like. And so there are 3 panels. One is We Work in Miracles, We Work in Hope, and We Work to Heal. So those are our 3 principles, and we talk about that within that piece. That is available whenever you're out and about and you want to feel like you need to have something that shows who LOPA is as an organization. It's a really good piece to have. This next one here is the Hope Act piece. And so we really felt like we needed to have an awareness of that people who are living with HIV can donate to other people living with HIV. And that was an important thing to show. So we have these rack cards available. Currently they're out and we can use them. Both of these pieces are currently being translated into Spanish and Vietnamese. The Spanish will be available in printed pieces. The Vietnamese will be online only. This next piece is a piece that's currently being printed. And it's Yes, You Can. It plays off of the Now You Can, which was the Hope Act brochure. But we found that there was a need to really debunk the myths that are out there. And so this is an empowering message that yes, you can be a hero. And the back talks about all the things you can do. You can still have an open casket funeral. You can, offer hope to 75 people. You can save up to 8 lives. All of those things are in this piece. This piece will be available at the end of the week, and we are printing about 10,000 of these, so they'll be available pretty readily available for everyone. So we're hoping that that's going to be a big help for people. It will also be translated into Spanish and Vietnamese. You can go to the next slide. Our impact, as you know, we do education programs, we do presentations, the earned media coverage and owned media coverage. I just wanted to talk to very briefly. Earned media coverage is what you'll see on the news. It is what other people, media have deemed appropriate and cover stories on our behalf. And that gives us extra credibility as an organization. Some PR professionals will say 2.5 to 3 times as much advertising value is given to an earned media coverage piece than advertising, because you do have that kind of third-party endorsement. If you go onto our website and you click on the YouTube channel, you will see some of our earned media. A lot of our media partners have given us the ability to put put stories on our YouTube channels that they've done. So Kim Holden's piece recently, and there was a piece in Monroe recently that are up there for you to see. Owned media coverage is really a new phenomenon, and that enables us to be our own media, because we can then go on our own channels and produce content that we deem appropriate. So for instance, this was the piece that Lana and Shalon did recently with Miss Walsh about her son, and that piece, we were able to have more flexibility with time, and we were able to tell the story our way. So those are the differences between earned media coverage and owned media. Both, all of our owned media coverage is in the YouTube channel as well as all of these sessions are divided up in there for you to see. The next section, the next slide, is really what we've done is really tried to formalize our programs. So we have different areas of focus. These really are deliberate, intentional strategies on our part to hit audiences in different ways and to make them comfortable about who we are as an organization and what we're actually asking them to do. So we divided it. We have 5 major goals this year, or areas of focus: volunteer education and engagement, healthy communities, media and public relations, and that would include hospital OMV visits, events, things like that, faith-based initiatives, and business collaboration initiatives. So what we've done is we've taken each of our community educators in areas that they specialize and put them as leads on these projects. And they're working with all of the community educators to develop these programs and offer them to our community. And really, it gives you guys as volunteers an opportunity to see where you might want to volunteer your time. You know, you may not want to do as many hospital visits, and you may say, look, I'm really involved in my church community. I want to be involved in faith-based initiatives. So it's going to open up, you know, a more diverse opportunity base for you guys as volunteers. So each one of these has a lead person that's working on these projects, and as we go through them, they will go ahead and give a brief overview. So we'll start with Lana, who is covering volunteer education and engagement.
Okay. So, you know, you guys know that as an extension of our LOPA Community Education team, you are part of our marketing team. You are out there with us. You're spreading the word, and you know, we want to be able to provide for you everything that can make you the best advocate, the best ambassador, or whatever you want to call it, or the best marketing team member of all of us. Some of the things that you'll start to be seeing rolling out is our continuous education. We are, even though things are starting to open up, I do believe that we are going to continue with these virtual Learn with LOPA sessions. We seem to have a decent feedback with it until, you know, we get someone, you know, if we get people starting to say that they're not interested, or our numbers start to really fall. But for now, we think we're going to continue with it as long as we have the content to share. And I think that we will. You will start to see more in-person training sessions across the state, whether it be in Covington, Lafayette, Shreveport, Baton Rouge. We're going to spread it across the state, and we're going to hope to start doing more in-person training sessions and have them more tailored to a specific subject, like the subjects that Jill briefly overviewed just now. And Susanna will kind of get into a little bit more of that when she presents in a bit too. We are working with some of our donor families. Now, we know that not all of our volunteers are donor families, but a large portion are. And we are also trying to recruit more donor family volunteers. And so some of those things that we have to offer them are, we're working currently on a donor family subcommittee, which is basically a team of donor families that will be able to give us feedback on how to better improve our donor family services program. We have, you know, for many years been able to offer our donor families the opportunity to share their loved one's story just through sharing a quilt square with us. And so we will continue with our quilt program. And last year we started with the donor family blanket making. We only had one session, and that was in Shreveport. We would like to get that across the state. And what this was an opportunity for, you know, donor families that have, their loved ones have become donors already and they have volunteered maybe with us for a while, to be able to come to us and come to our office kind of in a smaller setting, to be around other donor families only, and make these blankets that we can provide for our future donor families when their loved one is in the hospital. And so like I said, we've only had one session like that, but we got a lot of really great feedback from that. I believe Miss Benita's on the call tonight, and she was one of the ones in the photographs and someone that was part of that program. We're excited to see that get a little bigger. Some of the things that you can do to advocate are very simple. A lot of you all have been a part of some of these projects already, writing letters or making videos from home for our OMB or hospital staff, simply to thank them for what they do. Thank you for asking at the OMB. Thank you for your work that you do in the hospital. A simple share of your community or your business or financial donor contacts can really open up a lot of doors for things that we don't know. Maybe you have great contacts in the community that can get us in a place that can educate a lot more people. So we always really appreciate that form of volunteering as well. A lot of you all are mostly familiar with the story sharing your personal experience at schools, at churches, health fairs, or different community events. Many people have been involved with media interviews and multimedia, and that was kind of what Jill touched on the, kind of like the video we made with Miss Terry that we can use in our social media, on our website and our YouTube page and things like that. And then hospital development presentations. A lot of times when we're educating hospital staff about protocol, it's always nice to have a connect to purpose for one of our volunteers to share their personal story, whether it be as a donor family member or as a recipient family member, or however donation has touched you. I'd like to kind of pass this along to our next presenter, which is going to be Sharon and Cheryl. I believe Sharon's planning to present on healthy communities.
Hi, everybody. Yes, Cheryl and I have been doing outreach, grassroots type for a long time, 20 plus years on her part. And we came in contact with so many people that have been able to be a resource for us, that we wanted to be able to put all of that information in one document, to kind of call it a library, if you will, of resources and contact of other health communities, of other health people that can give us not only organ and tissue education, but prevention. Maybe if you have a patient or a family member that's on dialysis, can give you some nutritional information for our renal failure patients. So all of this is going to go in what we call our Healthy Communities portal. And it's just a resource library of everything that we have to offer everyone in the state when it comes to whether they want to be a living donor or if they want to donate their body to science. They can just call us and we should be able to get them in contact with the right people to get that information. It's going to be an interactive page, and you'll be able to click on links that will take you directly to the websites. You will also be able to click on some of the brochures that we offer as well, and it will open as a PDF and allow you to download and print as many as you may need to share with your friends and family. And it also will you'll be able to click on links to go to different videos and maybe some of our podcast episodes that talks about a specific subject. And we broke it down into 5 specific areas. You can go to the next page, Lena. And this is what it's going to look like. One of the areas is age, because we do get a lot of people thinking that they'll take themselves out of the registry because they feel like they're too old. Well, this will bring you to the resources that we have and letting them know that you're never too old to register. No matter your age, you can always sign up, and that we will determine at the time of death if the patient is suitable for donation. And just to let you know, the oldest donor we have is 95 years old. So it also brings you to that story to read more information about that. We have nutrition that will bring you to the downloadable cookbooks, and also we'll share with everyone how you can just incorporate some things to get on the preventative side of it. If you have a family history of high blood pressure or diabetes, we know that those are the number 1 and 2 causes of kidney failure. So if you have a family history of it, you may need to get screened earlier. There may be some things that you can do to change with your diet to make sure you don't get on the wrong side of diabetes and it's uncontrollable and wind up on the waiting list. We do have information on living donation, and it also will give you information on the kidney voucher program that's funded by the National Kidney Foundation, and that's for patients who are waiting. The average wait time for a kidney is 3 to 5 years. So some people may be interested in getting a kidney from a living, and this will bring you to that information as well as other resources. So this is just giving you an idea of what it will look like. We're still working on gathering some of our data and resources to plug into it, but it will be very interactive. So anyone at LOPA will be able to answer a question just by going to this library and getting the information that you may need. The next up, I think, is Susanna Morton from our Lafayette office.
Thanks, Sharon. So I'm Susanna, and I am the community educator in the Acadiana area. We're really excited about some of the initiatives and things we're doing with our media and public relations. And so I just want to talk briefly about a couple of different things. Kind of what we're doing and hoping to implement in the near future. Also, I have a partner with me, and she might make some noise while I'm sitting here. So one of the things that we want to do in the media and public relations work group is we're really trying to build our photo library especially for content for our website, and just in, kind of general things that like Lana was saying, social media posts and things like that. So in the near future, at events and things that we do, especially things that you all are a part of, we may be trying to get some kind of intentional photos. We've used some professional photographers this year at different events. I'm hoping to get some really good photography for all the different things we're needing that for. Another thing we've done this year is we've always done it, actually, for many years. But again, just being more mindful and working with our content, creating content, and working closely with our hospital professionals, the marketing departments. We were really excited this year. One of our hospitals here in Acadiana offered us their space in the newspaper during Donor Awareness Month. And they did a huge story on one of our donor families and, how they were affected by donation. It was a great story. And, we got that spot just from the relationship that we had built with, their marketing professionals at the hospital. And so we were really excited about that. Also, providing content for like their newsletters and any kind of internal things they may have, for their staff. So we're really working on doing things like that. We have a new media kit. So a big part of our job is sending press releases for different events and different things going on. And so when we do that, we really wanted to have a media kit available so that when they go to write their story about whatever it is we're pitching to them, they have all of the information, all of the facts about donation, everything about who LOPA is and what we do, correct vocabulary and language. And, we want to make sure that they're getting the correct information from all the right places. And so we can ensure that when we send them the media kit. So our branding department now is working to make that really pretty for us in order to be able to send out now. Lana, you can go to the next slide. Oh, I will say just in the pictures that you're seeing on these slides too, these were some actual interviews that we had done. And so the one on the previous slide was Whitney Dickerson. She's a kidney recipient. That was actually in Lake Charles, and it was in the studio. And then the slide here that you see now is Ronnie Platt. He is a heart recipient that did an interview for us for Father's Day. And that reporter actually went to his home to do that interview. So, and I'll point that out because one thing we really want to try to implement this year, and Lana was talking about having more in-person presentation, in-person trainings and gatherings for our volunteers. And so one of those things we're hoping to do soon in the near future is a media training for our volunteers. We decided that it will be done regionally, so each community educator will put this training on, and then it will be in person. So as of right now, there is no virtual aspect to it unless we see that we're going to need that. It will also probably be limited. There will be limited seating just because, you know, of the type of training it is. And so the purpose of it, though, is for any of you, and just to, I guess, kind of plug it and maybe get you thinking about it. Anybody who might be interested in helping us, you know, when we have events, if there are reporters there and they, you know, they're looking for a story to tell to our community, or, you know, it is Donor Awareness Month, or it's another specific, you know, month that they want to highlight one of your stories. You know, we want you to feel good about doing that. And I know right now we just have a handful of families who are comfortable talking to the media. So if it's something you think you might be interested in or want to do, then, you know, this would be a great training for you, because you're going to get to hear and see a lot of different things, I think, that help us, you know, be more comfortable in the media. And then another thing we're doing with the media and public relations, you know, are coming up with new story ideas. You know, we're trying to, you know, really strategically place stories with our media and within our hospital marketing departments. And then we are doing some quarterly pitches statewide to all of our media throughout the state. And then each community educator, you know, have great relationships with their media and will pitch, you know, local stories, much like the one of Ronnie that we did for Father's Day. We were really excited. We did it as an exclusive pitch to one station. And if that station hadn't picked it up or didn't want it, then we would, you know, we would have pitched it to another station. So they picked it up, and it was a beautiful story. And so, you know, we were really excited that they did that. So I think that's all I have.
Okay, so up next is going to be Sid, and she is going to present on our faith-based outreach.
Good evening, everyone. So one of the other programs we are in the process of planning and brainstorming and developing out is a faith-based outreach initiative. We know most of you are believers and active in your churches, and while we have been in churches to do presentations, we've, I think from experience, learned that most congregations and pastors are a lot more receptive when there's someone in the congregation who has been touched by donation. And that's where you'll come in. But some of the things that we've put together, for the most part, we've already assembled a council of pastors from each of the regions. And what we reached out to them asking them to help us do is really just advise, right? Advise us on scriptures for grief, on scriptures for healing. Give us feedback on what they think would be the best place to start, you know, for their congregations. Is the women's ministry or health and wellness more robust, or do they think that starting with the youth and children's ministry would be best? And so some of the resources we want to put together for our churches or our marketing materials related to our different observances, and then some general ones that they can use at any time. And so what I mean by marketing materials are, we know a lot of congregations are going back in person, but still with the option to live stream, or a lot of congregations are still doing Facebook Lives. And so we want to provide them with things that they can use on social media. We know a lot of churches have screens built in that they use during the announcement period. So information that we can put up on displays and bulletin boards. We know a lot of churches pass out things at the door or do inserts into their programs. So things like that we can use for holidays like that National Donate Life Month, holidays like in August coming up, National Multi-Ethnic Donor Awareness Month, as well as Donor Sabbath, which is a major one in November. And then, like I said, where do you all come in? We're hoping that our volunteers can say, hey, I'm a part of our health and wellness ministry at the church, and I think that we would love to help integrate you all into our church. Let me reach out to our pastor. Let me see if he's willing to let us put handouts in our programs. Or let me, you know what, I'm really good friends with the person that does reach out and see if willing to insert a slide into our morning announcements. And so at first we did start with full transparency here, trying to develop something for all faiths. And we kind of pared it back and decided to start with Baptist and non-denominational. After some slight research and crowdsourcing, we found out that most of our audience is Christian, non-denominational Baptist. And so we thought if we started just kind of with a general base, those would be materials that we could tweak and make applicable to other faiths, hopefully next year. So that's kind of my overview. Do I have any questions? We are still incredibly welcoming to feedback and any ideas that you all may have. We're working on a pretty robust campaign for National Donor Sabbath. So hopefully come November, October, we can kind of unveil that to you all.
Matter of fact, if you, your pastor, your first lady, or ministry leader would be interested, if you think they would be interested to be part of our council of pastors, please let us know.
Another thing we're starting is My Business Cares, and we all know, as everybody else said, without our community and our helpers, we would not be able to educate and reach out more to more people. And so what our Business Cares will be is they're going to be business with us. They will have a scorecard that they can go through to say, do little events, and they will earn points for the events that they do. So it can be something as easy as the host a lunch and learn. Well, an educator goes in and educates their staff about donation. They can participate in Blue and Green Day or volunteer a minimum of 20 hours a year with us, whether that's at an event that we host or that's something that they plan to do with us. And so there's a bronze, silver, and gold and platinum level of, and it has the total points that they receive, and that's what level they'll get. And so they'll get, you know, different things. Of course, if you reach platinum, you will get the most out of it. But just any little bit of outreach or any business that you know, you can get with your community educator, and they can get with that business and help them get involved for My Business Cares.
We kind of gave everyone a brief overview, and we want you to be able to give your feedback to us, or if you have any questions, the best way to do that is to either, I think most of you all have joined our regional Facebook groups. We have a lot of conversation and share different things within there. And you can also email us at info@lopa.org if you don't know who your community educator is, which I think most of you on here probably do, but either which way you can get to us from there.